And you're also married. You married a dentist. Did you, were you married before you became a neurosurgeon or after
I was
or
not.
during?
No, I got married in my third year of residency. I met
Okay.
Latoya in my third year, and we started dating. And then maybe about 5 months after we connected, we got engaged and then got married. And then shortly after that, started having kids. And so now we have 4 kids, 2 sets of twins. So our oldest set are about 22 months old, and then we have a new set that are about 3 weeks old. So we have
Wow.
2 sets of boy-girl twins.
Boys, a boy and a girl, boy
Boy,
set?
girl, boy, girl. Mhm.
Boy, girl, boy, girl. Wow. Wow, that's crazy. So four kids all together. Did the same thing your parents did with the Z. You did Z this time, not the M.
That's right. Yeah, we kept the Z's. Yeah, we kept the Z's going.
Now, would you let any of your kids, your boys, play football?
It's a great question. I would. I let Zayed and I let Zafar play football because I know how much football really meant to me.
Right.
How it helped me as a young person, sort of get out my temper and my anger and my rage a little bit, but also help me be competitive, help me learn how to lose, help me learn how to focus and have discipline. And it's given me the traits to allow me to be a good leader and a good physician. The one thing I would say is that the game, I think, needs to be changed, where we have to shorten the game, we have to put better technology around the game, in the helmets, in the mouthpieces, so we can censor some of these high velocity impact hits. We need to coach the game better. Some of the drills that I did as a young person, that should not be applicable to the game today. So there has to be some changes involved, but I love the sport of football. There's nothing like it, and I would definitely let my kids play under the right circumstances.
You said shorten the game. You talking about the game itself or the season? The short, so less than a short 4 quarters?
So I would shorten the time of each quarter. I would shorten the season, how many games people play. Because look, so we've done a lot of research on how concussions and how repetitive concussions affect people down the line. If you played football in the NFL for over 7 years, especially NFL, but we do believe that there's some correspondence and correlation to high school and college too. But if you played football for greater than 7 years, your chances of getting ALS, Lou Gehrig's disease, is tremendous. It's exponentially high, way different than the equal population of people who haven't played football. So these degenerative diseases that you get, CTE, ALS, early onset dementia and Alzheimer's, these sorts of things, they happen to people who play for a very long time. It doesn't matter how well you play, doesn't matter the position you play, doesn't matter the socioeconomic background you come from, but it's about length of play and length of time. And so I would not start playing football that early. I would shorten the games, the time of each quarter. I would shorten the amount of games in the season, and I would still allow the game to come forward and allow these young men and women, if they do play, to make the money and to go to college and do all the wonderful things that football has afforded me and others like me to do. But I wouldn't have it be a situation that it will cause deleterious health consequences. So when they finish playing, they're worried about getting ALS and dementia and not remembering their kids' names at the age of 35 or something like that.
2020, you worked in a 24-hour emergency room shifts, like round the clock, round the clock, round the clock during the COVID. How was that for you? And how did that actually, I guess you guys were trying to figure out what was the relationship with COVID and the brain? What were you doing?
Yeah, COVID was very difficult on all of us, especially our hospital. We are the main hospital in the New England area, so any patient from Maine or New Hampshire, Vermont, they're not going anywhere else. They're coming to Boston and they're coming to see us. And so when our elective cases for neurosurgery got postponed, the shift turned to all of us trying to volunteer in the emergency department to take care of all these patients who were coming off the street with COVID. And so I didn't know anything about COVID. I had to learn. I was basically a foot soldier, figuring out how this respiratory illness affected the lungs and the alveoli, the cells in the lungs, and how they cause this hyperinflammatory response. I was figuring it all out at once. But I think, again, being an athlete, being adjustable and flexible and being able to adapt on the fly, just like I would change from a man to man in the first quarter to a zone in the second quarter, I understood I had to change up my whole routine to go and be helpful and help try to save some lives. And so it was very difficult, but we made it through in that surge. We did still have to do a few neurosurgical cases, one in particular, a young man who was HIV positive, COVID positive, and had a disease called cryptococcal meningitis. I had to put a shunt in his head, and then that was I had to do it very quickly because if you stay in that room very long, your chances of getting COVID was exponentially high. My wife was pregnant at the time, so there was all these concerns floating around, but you had to sort of put aside your personal preference and you had to do the job because there are people who are counting on you.
Wow. Wow. February 2021, you were announced, Dr. Rose announced as a member of the board of directors for, what's that, Amboymed?
Abiomed.
Abiomed. That's a S&P 500 company. Bro, that company is worth like billions. Like, how did that happen with you? Like,
Yeah, that was actually a blessing. I was taking care of some pediatric patients at Boston Children's Hospital, and one young man was sitting there, and I just connected with him. And, it wasn't anything different. I didn't have to operate on him, didn't do any sort of surgery, no procedure. I just went to see him, visited him, see how he was doing, did his physical exam, talked to him and his parents, and his parent, one of his parents was actually the president of this company, Abiomed, and they just liked the way that I engaged with their child and engaged with the family, much different than any other care that they had gotten at that particular institution. And so we stayed connected. Next thing you know, there was a board position available, and now I'm able to be on this board. It's a medical tech device company for heart and lungs and kidney. It does a great job recovering these systems for people who are very sick, and being able to be a part of the leadership and direct initiatives that deal with vulnerable populations, marginalized populations, young people. It feels good to sort of take on a leadership role and do it at a corporate level. So it's been fantastic.
are you still involved in going, helping the people out in Zambia? Are you still involved in that?
So I spent 6 months in Zambia doing pediatric neurosurgery, and that was a part of my global neurosurgery fellowship, a rotation that I did. I was in Lusaka, the capital city, just learning how to do surgery when lights would shut off, when electricity would go off, when there wasn't oxygen available, like when there was all sorts of things happening, but yet you got to get the job done. And still, the Zambian neurosurgeons are phenomenal. They're able to work around these system and infrastructure deficits so well. It really helped give me a greater appreciation for how to do neurosurgery and how to really enjoy taking care of these people who are very sick, who don't have any money, but they're coming to you in a hospital that may be not as proficient as the one you're coming from in Boston, but it was a great experience. I loved it. And it really prepared me for what I'm trying to do back home in the Bahamas and through the Caribbean, my Caribbean Neurosurgery Foundation, working in low to middle income countries and trying to meet those individuals who are very vulnerable, sick, and who don't have the access to care, trying to meet them where they are.
Do you did, during your trip, I see that you had an operation on a young child. Tell us about that.
Yeah, there was a young person from actually Malawi, so not very far from the border of eastern Zambia. They came in. The thing that you have in Zambia and Malawi and other low and middle income countries, especially in sub-Saharan Africa, a lot of the kids get infections in their brain. They get meningitis or some level of infection. And when they get infected, the membranes that sort of allow the fluid to flow, you have this natural fluid-filled centers in your brain. Those membranes get scarred, they get thick, and they block the fluid. And so these kids end up getting really large heads, really big heads. Right. And so that's called hydrocephalus, or macrocephaly is the type of head, but hydrocephalus is the actual disease. And so I saw this patient, saw the mother, talked to her through the interpreter and said, I would love to take your child to surgery because I think he would need it. I think this is something that has to happen. If we don't operate, one, they can die, or two, they could have permanent developmental delay and be cognitively slow and regress than their peers. And so the mother agreed, signed informed consent. I put a shunt into the child's ventricle, tunneled it behind the ear, underneath the skin, over the clavicle, down the chest, and into the belly. So it was almost like they were drinking the fluid. And now I've done some follow-up on that child. The head is shrinking, the fluid is going down, and they're doing much better, and they're learning and developing just like any other child. So it was definitely a blessing and a really good outcome.
Wow, dope, man. Dope. Wow, nice, man. got interesting stories, bro. um, Early this year, now another story that I see that your aunt had got into an accident when in Bahamas, and she was hurt her brain, and she didn't get the attention that she could have got if she was here, right?
Yeah, that's absolutely right. It was actually in 2010 when this happened. I was playing.
It's 2010.
It was 2010. Yeah, I was
Oh,
playing for the
sorry.
Tennessee Titans. I was in Nashville, Tennessee, and my aunt was in Exuma, Bahamas, our home family island. She was walking down the street. Her name is Ann, and she was hit by a car and had a traumatic brain injury. Went to our local clinic, did not get a CT scan, did not get an MRI, no diagnostic imaging, did not see a nurse, did not see a neurosurgeon. For 7 hours, she waited in our local clinic, and then she ended up dying. The golden window for seeing patients with traumatic brain injury, especially acute traumatic brain injury, is 4 hours. And so she didn't see anyone for 7 hours, ended up passing away. So that was the impetus for me to start the Caribbean Neurosurgery Foundation, because I knew it was a preventable death. If she had done that in Boston or New York or San Francisco or any major city, any high-income country part of America, she'd be alive with us today. We'd take off her skull, we'd evacuated the blood, we put the skull back on, send her to the ICU, have her go to physical therapy, have her walk around a little bit, and she'd be out of the hospital in 3 days, home in time for Sunday to cook some peas and rice and go to church with us. So all this stuff, I knew that this could have been prevented, and that willed me to start the Caribbean Neurosurgery Foundation to help upscale neurosurgical capacity in the Caribbean, particularly in the Bahamas, so this does not happen again to any other family.
Released the book, The 2% Way. Explain what's the 2% way.
Yeah, the 2% way is a great philosophy and a mindset that I got from my football coach at Florida State University. His name was Mickey Andrews, and he would challenge me and my teammates every day to get a little bit better in our stamina, our ability to backpedal, our ability to high point the football. He just wanted us to have a real life, tangible goal of improvement. You know, some people say, man, I got 100% better today. That's impractical. You didn't double your talent in a day. But if you can get just a little bit better every single day, if you could win the days and keep stacking those days, then you can see a lot of progress and growth. And so I extrapolated that ideology and that mindset to life, so that any challenge or any obstacle, any goal, any task that I tried to accomplish, I applied this small steps, 2% consistent steps towards a better version of myself. And so this book talks about coming from the Bahamas, talks about going to Jersey, Florida, England, now to Boston and Harvard Neurosurgery, and how the challenges that I faced, from self-doubt to racism to prejudice to geographically being distanced from my wife, to workplace challenges, to feeling like I'm socially awkward in some certain settings, how I mitigated these challenges by applying this 2% way, blocking out the background noise, taking small steps every day, and seeing my growth and being a better version and a better person at the end of the day. So we're excited about it.
Right, you're not doing 100% turnaround right away. I get it. Gotta ask you, Antonio Brown, he claims he doesn't have CTE, right? You can't really check CTE once a person's rep. Why is that though?
Well, we don't have the technology yet to diagnose it based on imaging, right? So you can't get a CT or MRI just yet. And, you know, there's no sort of blood test to look for any sort of protein markers yet. These are all things that are being worked on by neuroscientists. Only can see it, as you alluded, when you're dead and you have an autopsy, you can actually look at the protein deposits in the brain physically.
It's kind of weird because I'm feeling like we're so advanced, so much advanced, you would think that they could see this. Shit, they could tell us the weather in 2 weeks. They can't, right? And you can't tell us that if this person has CTE, you bring a neurosurgeon, like, are you saying that they're working on this? Don't you think that this is something they should have had right away, right? Or like now?
Yeah, you know, I think there's growth and there's progress being made in that particular field, and it would be great, because I think people throw around CTE often to describe behaviors that may be different or abnormal or doesn't seem like it fits with the societal norms. And there may be other things happening in someone's life that's not related to CTE, but because it's something that we know, we throw a blanket statement over a lot of football players that this is what they have. Let's just let's just dismiss them because they have CTE and that's it. But, you know, there's other challenges. I mean, think about playing professional football and getting paid like this and getting attention and lights and camera and getting all this love, and then that stops, and then you have to go and be a regular citizen. That could be depressing. That could be hard on people. That could send your moods in all sorts of different areas. Your pain could be not tolerated very well, so you're relying on pain medications to sort of mitigate that. So there could be a lot of factors confluent all within your body working towards, a very dangerous outcome. It doesn't all have to be CTE. So I think we should be a little bit more cautious when we use that term, because it's not something that we can say as scientists, as medical professionals right now, just clinically seeing a patient. We can suspect it, but we can't definitively define it unless we, have somebody in autopsy and look at the protein under a microscope.
But when you say that, they go through that, there's other people that actually have 9-to-5 jobs, and then they're not doing that, They could be depressive. They could be going down. So it happens to a lot of people, football or not, right?
Absolutely. There's stressors that, release chemicals in our brain, cortisol in particular, that, increase our blood pressure, that put on weight, that put hair onto our body, that have these striations in our body, that make us feel anxious, that have our renal system not work as well, that have our heart pumping differently, that change our eyesight. I mean, all of this sort of works. So when people say stress is not just a nebulous concept. It is something that actually activates a process in the body, and particularly in the brain, that really can slow you down and prevent you from being your optimal self. And so I take that very seriously. We all as neuroscientists take it very seriously. And, the idea is to try to put these individuals, whether you're working a 9-to-5 job or whether you're a former professional athlete, put you in front of the right individuals to talk through these issues, the clinicians to help you mitigate these challenges and help you be a best version of yourself, where you're not harmful to yourself, you're actually productive for you and your community.
I used to hang out with this dude, and he was like a good friend of mine, Aaron Hernandez, and he suffered one of the most severe CTEs ever that they saw, right? And do you think that played a role in the murders and the suicide?
I think it possibly could have. I know Chico's, was somebody who was well loved by a lot of individuals, and, he had some challenges as well. And as you mentioned, when they did the look under the microscope of his brain, they saw the protein deposits, especially in the frontal lobe. Now, the frontal lobe is a part of the brain that controls executive functioning, aggression, violence. It controls personality. So you can see people change if they have an insult or an injury to this particular part of your brain. And it's not something that they're trying to do. Literally, their brain is being sort of hijacked based on these degenerative proteins that are being placed in this particular lobe in the brain.
Wait, I'm sorry to cut you off. Like you said, you could see this, the aggressiveness in the brain. You could see that in the brain. What'd you just say?
So the frontal lobe helps control your mood and your executive functioning and your personality. And so the aggression that comes from people who have a disinhibited frontal lobe can be a result of having the CTE or the protein deposits or a bleed or an infection or a tumor that hits that particular lobe in the brain. And so, when you think about somebody like Aaron or others who have resorted to violence, who have been a little bit more aggressive than maybe norm, than they have shown in the past, you have to think that there is an insult, there's an injury to that area, and you can sort of correlate where this protein and where this injury and where this degeneration is happening with the actions that they're doing. And so those two things can go together, and it's unfortunate that it happened for him and the outcome that happened.
Oh, okay. Wow, man. Thank you, man. Appreciate it. I could go on for a long time, but I know we gotta go. Appreciate you, Dr. Rolle. This is an interesting conversation, man.
Thank you.
Because I'm used to talking to these rappers and stuff like that, but speaking to the doctor and getting this information is well needed. And he gave me that one-on-one. Appreciate you.
Thank you, brother. I appreciate you.
Thank you, man. Good luck in everything you're doing, man.
Yes, sir.
We need guys like you, bro.
Thank you.